Alright, skinfold testing today. We're going to use a set of skinfold calipers, of which they are always to be held in the right hand. The left hand is the pinching hand, in which we're going to pinch and pull out the fold of skin that we're going to measure in millimeters. I've already marked out certain landmarks from the previous test, the girth measurement test on Andre. We're going to just measure out the other few that we have to do. So the calipers are always to be held below the fingers. Always to be held below the fingers. We're taking a 1 to 2 centimeter pinch of skin and measuring it with the calipers. So, before I move on any further, we have noted down already the bicep measurements, the tricep measurements. I'm going to spin Andre around and just mark out, one more time there please Andre, with the subscapular measurement. And to do this, I'm going to ask Andre to place the palm of or the front of his hand on his lower back. We see the inferior angle of the scapula start to protrude through the skin. From there, I'm going to grab my tape measure in centimeters and just mark out 2 centimeters directly down on the vertical from this bony prominence. Great stuff. And just do mind spinning back round again to the front. Thanks, Andre. Great stuff. Okay, the next measurement, we're just going to locate his ilium at the top. So, Andre, just locate the top of your pelvis for me, please. That's it. And from there, we're going to find the AFIS, which is again the bony landmark, the anterior superior iliac spine, the bony landmark at the front of the pelvis. From that point on, we're going to place a 7 centimeter mark tape measure. Okay, and have it directly up on the vertical and mark that. The pinch we'll take will be at a 45-degree angle in line with both the oblique fold and the iliac crest. Okay. We're going to leave the umbilicus as with the mid-axilla, and we're going to move straight onto the thigh, which is already marked from the previous girth measurement, and we're going to mark out the calf, which we had done from the previous measurement. The calf, just to remind you, was the widest point looking from the front and on the medial aspect. And we have to actually have that taken with the foot on the chair to relax some of the tissues that have been taken. So we're all marked out, we're ready to go with the calipers. We would do this normally 3 times and work out an average for each side. Obviously the more sides that are taken, or the more times the sides is taken, the more accurate the test will be. So, where we go. So I'm just going to have you in the anatomical position, please, sir. We're going to take a pinch just on that mark we marked out on his bicep. And we can see Andre's quite a lean, muscular chap, so if we could get him just to bend his arm for me, just to ensure I've grabbed no fascia, which I can actually see I have. If I've grabbed muscle fascia, the skin will be pulled away from my fingers, which it has done, so I'll get to relax there again. Take a slightly smaller pinch, good, I've still got hold of it, you can relax that there. The elbow to be held nice and high, so that as the calipers are at 90 degrees to the skin. Just relax the arm there completely on there. Okay, allow the calipers to settle. And relax. Note that down. Wonderful. And if I can get you just to spin full 360 or 180, I should say, around. Wonderful. We put that arm just down by the side. Just relax there. Thank you. There's the triceps landmark there. Pinching just above the landmark, ask the client just to extend his elbow, just to ensure that there's no otherwise straighten your arm there, thanks. That's it. Still got the subcutaneous fat that we wanted, and relax there, please, Andre. Elbow nice and high. Just in line with that landmark, ensure the calipers are at 90 degrees to the skin and not at an angle, otherwise it will be inaccurate reading. Okay, allow them time to settle. And then relax. Okay, while we're here, we've got the client facing us, his back to us already, so we've got that wonderful subscapular landmark already noted out. A 2-finger pinch just above that landmark on the 45-degree angle, which normally tends to be in line with the medial border of the scapula. Take a 2 centimeter pinch just above that. You can see it nicely comes away from the back. Nice and gentle. Allow it to settle. Take a reading and just note that down. Alright, nearly there. Full 180 turns, please, Andre. Doing a splendid job. We'll just traverse the way down. We've got the iliac crest landmark noted out there for us. We found, again, 2 centimetre pinch, 45 degree in line with that oblique fold and the iliac crest, the top of the ilium. Pull away. Allow to settle and record the results. Okay, last 2 readings. For this, we will need to bring a chair out. Makes it a little bit easier to take the reading. Only if I could ask you, as you were standing, just to place your right leg on the chair, just like so. If you could clasp your hands underneath your hamstring, place all the weight on the back leg. That's it, and pull the tissues and musculature up towards the ceiling. So loosen some of these superficial and visceral tissues of the side. He's a very lean bloke. As you can see, this needs to be done. It really lifts that tissue. I can barely get a pinch. I'll do the best as I can. Elbow high. The most anterior portion of the thigh in line where the girth measurements are taken. And relax. Record the result. Okay, last one. The calf we have measured out already. The medial portion, the widest point seen from the front, landmarked on the side. 2 fingers, pull away, parallel with, in 90-degree angle with the skin, the calipers to be held, 5 millimeters, and relax. Alright, thanks so much. You can pop your leg down there. You can top those results up, pop them into a formula, read them from a chart as a percentage.